Lung cancer is a disease and a cancer that affects many people, that primarily is located in the lung, at least to start with, and sometimes can have disease which extends beyond that.
Lung cancer is the #1 cause of cancer deaths in the United States, and the key to treating it is early detection. If it's discovered at later stages, the prognosis can be grim.
So lung cancer is like any cancer, except it's specific to the lung itself, usually associated with smoking, but 15% of all lung cancers are in non-smokers. So we're looking for it actively through screening programs, trying to get people to stop smoking, etc. So it's an important thing for us to look at, especially living in this area in the region where you've got steel mills, high percentage of people smoking, so it's important for us. You can go in and get a lung screen. It's a simple low-dose CAT scan. There's no risk to it. There's no IVs. It takes a few minutes. You lay there. That's all you have to do. You lay down and get a screen, and then they can evaluate you through your family practitioner or other specialists, lung cancer surgeons or lung cancer pulmonologists, to say this is a benign tumor, this is not, we need to do further tests. No, let's just watch it and get some scans down the road.
So if something is found on a screening lung CT scan that is considered high risk for being lung cancer, there may be additional tests that you need to go through. One thing that we have at Franciscan Crown Point is a navigational bronchoscopy platform called the ION, which allows even very small nodules that were previously not amenable to biopsy to be accessed in order to find out what they are.
So when you have a tumor of any kind, anywhere, you need to biopsy it and make sure it's not cancer. And there are maximally invasive ways, big surgery, and then there's minimally invasive ways. A needle, a bronchoscopy where they just go down into your lungs and look. We have the ion bronchoscope here and the robot so that where we can take a robot and a bronchoscope and combine them, go down and find even the smallest of nodules and biopsy it without surgery, without cutting you open, nothing, and get a result that says benign or malignant.
The really great thing about this is that it allows for a much more precise biopsy, or a sample, allows you to get to farther areas of the lung that you previously couldn't get to before. You can get better samples and put the patient hopefully at less risk whenever you're doing any kind of sampling.
God forbid, but if it's cancer, we have to address it. The best chance you have of being cured of any tumor is getting it out. So we can then take you and use another robot, the Da Vinci robot. We can take that nodule out using a robot, biopsy it and say, yes, this is definitely cancer, and do a limited lung resection or a lobectomy, more major, all through little keyholes in your chest, and you are cured of the cancer right then and there, diagnosed and treated, one-stop shop, and then go home sooner with no big incisions and recover faster. We have that available here now. We're one of the only centers in Indiana and the metropolitan area that has that. So historically, people of my parents' generation from this area went to the Mayo Clinic 50 years ago. Now, 30 years ago, it was, we don't have to go there, let's go to Chicago. We all realized that we can bring academic care right to your own backyard here at Franciscan. So in the region at Franciscan Health Crown Point, where we're at now, we can bring patients into the Burrell Cancer Center and provide them a multidisciplinary experience, just like the Mayo Clinic, so that your family can be a part of that process. You don't have to fly or drive long distances to get that care for your follow-up, for the treatment. Your family can be with you. And that translates to better outcomes. Patients are happier, families can participate, and you get great cancer treatment or non-cancer treatment, hopefully, with the physicians we have here at Franciscan Health.